Hi, good morning, everyone. My name is Neil Arwin Mercado, reporter for INQUIRER.net. Today, we are going to talk about a topic that is very relevant. We are going to talk about convalescent plasma donation and transfusion, which many medical experts say could help in the recovery of COVID-19 patients. And we actually talked about this a couple of weeks ago, and we were able to interview Dr. Francisco Lopez, a hematologist from St. Luke's Medical Center, who joins us here today to talk about this topic. But our focus for today would be on the progress and the update on the on patients who were able to receive plasma from recovered COVID-19 patients. So, Doc, good morning. It's nice to see you again.
Good morning, Neil, and good morning to all the televiewers. Thank you
How
for
are
having
you
me.
doing, sir?
I'm doing well, and how are you?
Doing well, sir. Still in quarantine dito sa dito sa work from home pa rin tayo, sir. So, sir, we were able to talk about this a couple of weeks ago. Para lang doon sa mga hindi nakapanood ng ating interview, can you give us a refresher, sir, on the importance of convalescent plasma donation and transfusion? What is it about, and how can recovered COVID-19 patients help those who are still afflicted with the disease?
Yeah. So when a patient has recovered from COVID-19, they produce antibodies, no? And these antibodies help fight the infection. And when they recover, we can collect their plasma, and this plasma is rich with antibodies. And this is what we call convalescent plasma. And this is what we transfuse to the recipient, a patient who is in critical condition or is in need of the plasma.
How can the plasma from a bakit sir mas why are we saying that plasma from recovered COVID-19 patients can help? In what way can it help, sir, yung mga patients who are still afflicted with the disease?
Well, one, there's really no approved treatment for this COVID-19. No? And historically, if you look back in the different epidemics, no, like the SARS, the MERS, the Ebola, they were using the plasma from recovered patients to treat these patients. No? So the whole concept and theory of giving plasma is not new. No? Now we have a new virus, no, the COVID-19, and so we are using the plasma, which is rich in the antibodies, to help fight the infection. And if you control the infection, all the consequences like the lung injury and the other problems, we might be able to halt the progression of the disease.
Mhm. So sir, when we had our interview a couple of weeks ago, nasa early stage pa lang tayo noong convalescent plasma donation. Only a few people have donated at that time. Now sir, we had weeks na to check this. Meron na tayong mga nasalinan din ng plasma na from recovered patient to a person who is still afflicted with the disease, sir. Ano ang progress natin so far, sir? Ano ang condition nitong mga nabigyan natin ng plasma?
So in summary, we started po in April 11. That was the first time we infused. So far, we already have 13 recipients of this plasma. And the 12 of these patients were critically ill. They were in ventilators. And one was progressing to illness. No? Out of the 12 who were in the ventilator, five of them were able to wean off from the ventilator, or in medical terms, were extubated from the ventilator. Some as early as 2 days after the convalescent plasma was given, in one patient 6 days after. For that one patient who was progressing to severe illness or was not on a ventilator, we were able to halt the progression of his disease and did not require the ventilator. When we were analyzing the data, there seems to be a period of within 14 days where we see the response of the treatment. So 6 out of these 12 patients or 13 patients the plasma was given within 14 days.
So sir, in summary, you're saying na mayroong parang preferred period within
Yes.
the 14 days, sir. This 14 days, sir, within the start of the symptoms or within the confirmation of COVID-19?
It's a start of the symptom. So you start counting when the symptoms began. and you want to give it within 14 days. So we see that the recovery seems to be faster. We can get them off the ventilator right away. So all of these will translate in less ventilator days. Will also less ICU stay. And eventually what we want is to lessen the hospital cost, and hospital days of the recipient.
With this number, sir, is it already safe to say that the plasma from recovered COVID-19 patients can really help itong mga persons who are still afflicted? Because you're saying essentially that patients who receive plasma are getting better.
Yeah. Well, again, 13 is still a small number. When you review literature, again, these are just case series. But again, our results seem to be encouraging, and I think also the PGH group presented their own data, and I think they were also encouraged that they saw some improvement in their patients. So I think it's an option for the recipient to receive this. Other treatments may be quite expensive, when they use other medicines.
Please correct me if I'm wrong, sir. Pero based on our last interview, just because you received plasma from a recovered COVID-19 patients, hindi nun ibig sabihin na nagsa-stop na yung other treatments mo, sir, for COVID-19.
No, not yet. Not yet, but the other supportive care is there. So when we start off with, let's say, hydroxychloroquine, we do not stop it. Then we give the plasma right away, if the patient needs it.
Okay, sir. Now, sir, what are our indicators in saying that a person who received plasma from a recovered COVID-19 patient is getting better?
Well, one, less oxygen requirement. And for those who are intubated, they get off the ventilator. And then we also see improvement in their chest x-rays. We have other biomarkers or other markers of inflammation that we check on a regular basis, and we see that these levels start to decrease after we give the convalescent plasma.
So, sir, we were talking a bit before our interview, and isa sa mga tanong na pumasok lang bigla sa utak ko is, paano ba pinipili who will receive plasma from a recovered patient, sir? Meron ba tayong order of priority sa ating mga patients?
Well, one, again, the criteria, are they critically ill, or is their condition progressing to severe illness? And we have our own Viber group, and they will just post it. We need X number of donors for X number of recipients. And then we start looking for the donors in our donor pool. And again, who will get the plasma first is, again, we have to see who is more critical than the other. If we have to choose between, let's say, 2 patients or amongst 3 patients, we have to decide who is more critical. Then we'll give the plasma right away.
So, sir, we talked about a 14-day period, sir, na ito yung tinitingnan natin na window time na dapat maibigay talaga itong plasma to a patient, sir. Are we facing some issues, sir? Particularly on, kasi sa mga ano pa lang, sir, paglabas pa lang ng results, it takes days before a patient knows if he or she is positive of COVID-19. But you're saying that the 14-day period includes yung symptoms pa lang kahit hindi pa confirmed, sir.
Yes. Well, one, if it takes 10 days to get the results, the doctor might be hesitant to give the plasma until there's confirmation. Number 2, or the recipient might be also hesitant to receive the plasma. And if you have to wait for that long, and hopefully it will get shorter this time, that more centers are providing this service, then we can immediately decide whether we should give the plasma or not to the recipients. So again, that is also crucial, to get the results right away and not have to wait 10 days or even longer to get the results.
Kasi sayang din, sir, yung time na we're waiting for the results na sana na ibigay na kaagad yung plasma.
Again, I said within 14 days is what we want to do.
So now, sir, isa pa sa mga problems na kinakatakutan noong public is the economic cost of getting this disease, sir. When let's talk specifically about convalescent plasma, sir. Meron ba itong bayad din? Meron bang kailangan bayaran ng mga recipients?
Well, if the plasma is given to the patient here in St. Luke's, now there is no charge. The St. Luke's Foundation has given us a grant for this, and the donation is free, and the recipient will not have to pay anything, no, for this.
Okay, sir. Balikan ko lang saglit, sir, itong mga donation para doon sa mga nanonood natin na who might want to donate for our recovered COVID-19 patients who might want to donate, sir. Meron ba tayong requirements for our doon sa mga gusto mag-donate? Do they have to meet certain requirements for them to be allowed to donate plasma?
Well, maybe just one, we require, again, confirmation that they got infected. Number two, again, 2 negative swabs. And if they had 1 negative swab, they can repeat their swab here in St. Luke's. We were already given the FDA approval as a center. Number three, we will check their antibody titers, no, to make sure that they are already producing the antibodies prior to collecting their plasma. Now, if there is a patient in need, we try to do everything, the checking of the antibody titers and the collection within 2.5 to 3 hours. The donation is free. The donor will not pay for anything, any of these tests.
Okay, sir. Let's wrap this interview with an invite, sir, for recovered COVID-19 patients to help them yung mga patients right now.
Yeah. Nian, if you don't mind, I would just have to say there's some good news, no? If you don't mind,
Sure.
good news from St. Luke's, no? So St. Luke's Medical Center, in cooperation with Security Bank Foundation, will provide free convalescent plasma to those who cannot afford, no? And if you allow me, I would like to read the message of Security Bank Foundation.
Sure, sir.
Security Bank Foundation is very privileged to have Security Bank as our exclusive bank partner in this project. They have been a strong and supportive and financial service partner of St. Luke's Medical Center. Security Bank Foundation has aligned values and mission of enriching lives. They are excited to have St. Luke's Medical Center in this important game-changing treatment of saving lives. No? So we are in the process of meeting with the Security Bank Foundation and ironing out the details of this project. And once we've ironed it out, St. Luke's, both QC, Quezon City, and Global City will be providing a free convalescent plasma to those who cannot afford. So maybe by next week, we'll be able to announce the details of this project.
That's good news, sir. So, sir, final call to recovered COVID-19 patients who might want to donate. Where can they donate? Where can they go?
Again, since we've been encouraged with the preliminary results of our study, so we are donors or COVID-19 donors who have recovered to come and donate their convalescent plasma. They can contact St. Luke's, Quezon City, and Global City, and we will take care of them after we receive their phone call and triage them to what they need, what other tests they need to do. No? And again, the limiting factor here is always the donor. No? Even if we have the recipients who are waiting, and if we don't have the donor, we will not be able to give it within the 14-day period that we want to give to our COVID survivors.
Thank you so much, Dr. Francisco Lopez, hematologist in St. Luke's Medical Center. Thank you for your time, sir.
Yeah, Neil, thank you very much for inviting us back.
Again, this is Neil Arwin Mercado, reporter for INQUIRER.net. Everyone, please stay safe, stay home.
Bye.